Hi folks, my name is Dr. Dhaliwal. I'm the director at South Etobicoke Animal Hospital in Toronto, Fletcher's Creek Animal Hospital in Brampton, Countryside Veterinary Mobile Services that services almost all of Ontario. So today we're going to talk about dentistry in pets. The month of February is the dental month, which is the National Dental Month, but our promotions that for the dentistry, they go for almost the whole year as well. So let's talk about dentistry in pets. There's a lot of statistical data out there, and you can get it from your own veterinarian. You can read journal articles that says about 80 to 85% of our pet population is suffering from some kind of a dental disease. Now, it's very important because there's a lot of that information that you can read in the paper, but when you look at your own pet's teeth, you say, everything's looking great, nothing's really wrong with it. Because that's the tip of the iceberg. You're only looking at the tip. You're not looking at the whole iceberg, which is hidden underneath the gums. It's hidden underneath the socket in the bone. And that is what comes into play when we do our examination and our diagnostics. So it's very important that we touch base with that. So I'm going to use our little markers and then show what you see. So let's say you see this as the top of the tooth. This is the crown. That's the only thing you see. Maybe you see a little bit of dustiness over there, which is plaque. Plaque is that yellow, stingy material that's made up of bacteria and food particles. Or you may see a little buildup of something called tartar over there, which is all the calcium, all the other mineral elements that get accumulated over time when you don't brush the teeth, of course. But what you don't see is that this tooth also has a neck and a root, and it's supported by the gums and the little bony socket where it's associated with. This thing you don't see. This can only be seen when you do dental x-rays. So we need to do that to find out what's happening, because that's where you can see if there is a cavity, or this tooth is rotten, or there is a big abscess or infection at the bottom. That's the only way to see it. So when you only see this and you see a nice clean crown, I don't want to get my dental done because my cat's teeth or my doggy's teeth are absolutely in good health. But the reality is different. So that can only be seen through the diagnostics. It's known now, there was a big controversy going on whether dental disease is associated with something like heart disease, hip disease, bone problems, kidney issues. But I think we have reached a point now that we can tell that it is associated with a lot of those, because this is a potential source of entry of pathogens, toxins into the body. So if this is the source and you're looking at the source, why not treat the thing at the source, not let it enter into the system? So that's why prevention is always better than cure. If I can prevent a little bit of plaque over there, prevent it from becoming a full-blown tartar, I've saved my cat's life. I've saved my dog's life. Longevity comes into play as well. We want to have a very good life. We don't want to have a pharmacy dog or a pharmacy cat. It means they have loaded with medications, 3 or 4 pills a day. That's not easy. Training a cat, they reject everything that's given into their mouth. Dogs, we need to give them more treats. More treats means we're adding fuel to fire. It's going to cause more problems. So let's get use of our dental promo for the month of February, and let's get our pet teeth cleaned, polished, and that look nice and sparkly, not only on the top, but right to the bottom. Get rid of all those things that are causing the problem and have a smiley, happy cat and a happy dog. Enjoy the dental month.